As a mom, wife, and daughter, Caisey Heaton wants to make sure she is around for all of life's special moments. With a history of cancer in her family, she wanted to know her genetic risk.
It started with my great aunt on my maternal mother's side, and she was diagnosed at 24 years old with breast cancer, and she passed away at 24 years old. So then my maternal grandfather, at 68 years old, was diagnosed with prostate cancer, and he passed away at 70. So then my mother, when I was 15, she decided to do the genetic testing. It showed a mutation in the BRCA2 gene.
Living in a different state at the time, when she was only 19 years old, she decided to do genetic counseling and testing.
We went to the lab, I had blood work done, non-invasive, easy peasy. A few weeks later, I got a phone call from the genetic counselor, and she said I needed to come in. Sat down with me and she said, "I'm so sorry, but you are positive for the BRCA2 gene mutation."
So BRCA1 and BRCA2 are the two most common genes related to an inherited risk for breast cancer, ovarian cancer, pancreatic cancer, and prostate cancer. They're very common. About 1 in 400 people have a mutation in them. If they test positive for either a BRCA1 or a BRCA2, it can impact what surgery they might want to do. There are certain medications that can be used with those genes. It might help them with future preventative options.
Now, age 32 and living in Sioux Falls, Caisey decided to take steps to help lower her risk of cancer. She made an appointment at the Avera Breast Center.
Her lifetime risk was very significant, and so she opted for risk reduction.
Caisey had a prophylactic double mastectomy with reconstruction.
It's such peace of mind. Like, okay, I went from 87% chance of getting cancer to a 7%.
So I think whether a patient pursues risk reduction surgery is very patient dependent. Generally, patients have to have a pretty significant risk of developing breast cancer to really consider risk reduction surgery, because it is a big decision to go on to mastectomies with or without reconstruction. But it's really a conversation that I think high-risk patients can have with their surgeon to kind of talk through, is this an option for them?
Caisey hopes sharing her story can encourage others to understand their genetic risk, and she now feels more confident in her future.
So now it's like a new chapter. It's exciting to that weight is no longer on me, and now I can just watch my babies grow and hopefully watch their babies grow.